Welcome to the Expert Facilitator Session. Today we have two distinguished, very involved and young dental surgeon and expert dental surgeon in our panel, and we are going to discuss about the how do you start and how do you run a successful dental enterprise or setup. So many of you are having a lot of experience also, so others can also contribute in between the end wherever they are wanting to add. We will be taking the two case studies. One is Dr. Dhaval. He is a practicing surgeon in Bombay, right? So he is at one extreme where he is in a metropolitan city. Other extreme is Atindra, who is in how many kilometers? 50 kilometers from Guwahati, right?
50 kilometers Guwahati, sir.
50 kilometers to Guwahati. Small town place. So welcome Dhaval and welcome Atindra. Just introduce you. I'll just introduce them to you. Dr. Dhaval is actually a 1996 batch alumni from MS Ramaiah Dental College Hospital under Rajiv Gandhi Hospitals, Karnataka. It is post-graduation in the periodontology, and it is from the Parvara College in Maharashtra. And then he went for 1 year fellowship in Implant and Aesthetic Dentistry. He has been a fellow, and he has done academic observership in US, Petersburg, and he received his MDFS, MFDS, RCPS, Glasgow, UK diploma, and even multiple positions he has been quite experienced. And he'll share his learnings and his ideas about dental practice today. Yes. And
thank you.
Atindra is a very nice person. He is almost like a friend now. He is mostly there in regularly is there in all the meetings. If there is somebody I'll look for it, he is Atindra, right?
Thank you, sir.
He started from a single second-hand dental chair in Joregaon, Guwahati, and now started. He's a dentist and he has fought all the odds, and now he is having multiple setups in nearby Guwahati. We will be sharing the idea about how a small setup or a small place can grow big with time if you are persistent in your efforts. Welcome both of you.
Thank you, sir.
Thank you, sir.
I'd like that you also introduce yourself in your own way, so that if I have done an injustice to you, you can compensate there. Right? Before that, I'll just ask all the audience that please write if you're a dentist or no in the chat box so that I can understand. Yes or no. If you are a dentist or dental surgeon or a oromaxillofacial surgeon or cosmetic surgeon related to dentistry, please write yes. And if you're not, then you write no. There are a few people. And one more thing, please, if you're a dentist or a dental surgeon, write how many years of experience you have. 1, 2, 3, 4, 5, whatever experience you have, so that you can come to know what is the seniority people are having. Yes, no, yes, no. So there are different branches are also there. This is there. Yeah. Dhaval has 18 years. 18 years. Fair enough. So you can start from your brief profile that what you are doing, and then we can take the questions. First, I'll be asking questions to them, then others can ask. Right? So get going. Let's get going. Yes, Dhaval.
Yes, sir. Thank you, sir, and the Dentopreneur Academy for having this session here. And I think in my 18 years of experience, my path was very different. From 2008 December, I finished my post-graduation. And then onwards, I didn't jump into running my own practice. So what I did was I started into consulting practice and focused only on my specialty, periodontics and implant dentistry. And for about 13 years, I was only a consultant to some of the clinics and hospital around Mumbai. And I used to go also out of Maharashtra and in and around Maharashtra for my specialty. And my focus was only ethical and evidence-based practice. Having said that, it was during the pandemic time that my wife Purvi and I, we decided that we need to have our own setup and we need to run our own practice because of multiple challenges. That's when what we did was we took over a very small practice, and this was in the first wave of COVID-19 pandemic. And then we started from there, and we stopped our consulting practice and we focused more on our practice. And it was more of a specialty practice focusing on general as well as specialty dental practice. And the focus was more on our team learning more the technical aspects and also giving evidence opinions to patients. In hindsight, this was the best decision because immediately when we joined, we started our own practice. I came to know about the Dentopreneur Academy, and I enrolled as a member. And I still remember the journey in the last 2 years has been very good, especially with all the webinars happening and the subjects which we are not very familiar with during our technical training days. So I really thank Pranav sir and Amit sir and the entire team for the growth of not only my practice, but I think I've seen a lot of dentists and generally the medical professions who are enrolled in the academy seeing that kind of growth.
Great. Great. Fantastic. It is your active involvement which keeps us drive. Right. Yes, Atindra, please.
So good evening once again, everyone. So as sir has mentioned, I belong to a place near Jagi Road. It is 50 kilometers from Guwahati Metro City. Dental practice in the rural area and the dental practice in the urban area is a bit different. Here, more people get to the dental clinic when they have pain, dental pain. So lack of awareness, one of the main factor that they don't step in for a dental treatment. So I belong to Northeast, and previously in our locality, people has to wait for a month to get a dental checkup because the dentist used to come from Guwahati Metro. So side by side, once in 15 days, they used to come. So the Sunday is the market day for Jagi Road. So they have to wait again, just reduced. Then some 1 or 2 dentists started coming. That also they have to wait for 1 week. So it's a population of more than 9 lakhs in our district. So there are only countable number of dentists hardly in the civil hospital, and this is the subdivision place that is Jagi Road. So in that scenario, when I first set my clinic, I passed out in 2009, and 2010 I completed my internship. Then from that day onwards, I had a how to set up a dental clinic. So that time, just passing out in a place like from a place like Jagi Road was quite challenging. So what I did, the financial problem was one of the factors. So at that time, I got some money saved from the stipend, some from the parents, and some help from friends. So I managed to get a old dental chair. So I started my practice, and people started knowing, and I started also arranging some camps to make people aware about the dental health. So what are the consequences of the poor oral health on the general health? As a result, some people started knowing me and they started visiting slowly by slowly. Also, I used to visit the nearby medical stores where people used to come and ask for, is there any dentist available? So before, as they knew that only once in a week they will get a dentist, but the time is reduced. Now every day they get a dentist. When I was doing my husbandship also, I used to travel from Jagi Road to Guwahati. That time also, in the daytime I work in the hospital. The evening time I come and patient used to wait for me. So slowly by slowly, my practice started growing. So at present, though I started from an old dental chair, in one location, at present I have 5 new dental chairs in 4 locations.
So somebody who is thinking about growth and no growth and competition, it is there, patients are waiting for you. You must have the guts to go there. This is what is important. And if you are in a city and you are crying about the competition, you have to put it strategically properly so that you can be successful. There are ways out. There are 100 ways of doing something, and there are 101 ways of not doing it. Right? So I'll ask one question to both of you, and I'll expect your perspective, because we have chosen the two extremes of the country. So we might have a different answers to the same question. So Dhaval, what is the importance of location in your practice? How do you choose it when you are starting?
So, this is a very important question. So when we were looking out for purchasing our practice in 2021, after 18 years of consulting, our number one reason for location of our practice was our commute has to be the least. That we don't take too much into account. So what happens is generally then there is a burnout of the dentist and the dental office team. So I feel that that is one of the primary factors which we need to consider in terms of location. Then the other important factors which would follow, according to me, would be accessibility or location of the dental practice near to any railway station or landmarks like any metro station, major roads, etc., with accessibility to senior citizens. So that is something I would lay my second importance and emphasis on in terms of location.
Atindra, what is your take?
Yes, sir. The age group is a factor, the target group which you are going to target. And in dentistry, there are from pediatric to middle age, adolescent, adults, young adult, and old age, geriatric. Everyone, there is a need for dentistry. So in such a scenario, we'll find a place where there is a density of the population, where there will be more number of people. This is the prime factor. And also the competition part is there. If there are so many dentists in a place and the people has to, then one place is leaving vacant. So if you can choose a location, also the accessibility factor is there. The patient can afford to go in that place easily, and then it is the most priority.
Next one is how much money does it require to set up a practice, and how did you manage it? How did you, initial funds, where did it come from? Dhaval.
So, sir, this can be answered in many ways, depending on what kind of practice one needs to set up. I think if you're looking at a very basic setup, like we honestly, when we wanted to purchase a practice, our practice purchase was a single operatory and a very basic dental practice which we wanted to set up. I think it can easily be managed within a range of about 10 lakhs to 12 lakhs, to be very simple. How we managed was I already was working as a consultant, so I had managed to do a lot of savings then, and any additional requirement which I needed, my wife was there to chip in. This is how my story was, sir.
Atindra.
To begin with, first one dental chair is sufficient to manage. So what I did in my case is I purchased an old dental chair. It worked, and for that you need some consumables. Initially, we can go for X-ray machine, which needs a developer. Not RVG is not recommended. Initially, when I started, I didn't use RVG. I used that conventional one, and thereby I was saving a lot of money. And gradually, when there was lots of revenue coming, I shifted to the modern RVG gadgets where no dark room is required.
So what are the initial investment?
Also, even for RCT also.
Yeah, carry on.
It's not visible. Even for RCT also.
Dhaval, you think that around 10 lakh is okay, na? So you can easily say get it from your savings.
Yes, sir. So, sir, here is the catch. For a majority of the young graduates who are now passing out from dental colleges, for them, the thought process is that you need a large sum of capital
Yeah.
to start a practice. In my experience and in my view, it's not actually true. It all depends on how do you want to start. And as rightly said by Atindra, I completely agree with him that even we started with very basic thing, and we were very particular in terms of, investing in the basic thing with low cost. And then slightly as a revenue and capital went on increasing, we started upgrading our practice and having that sort of balance.
Yes, Atindra, you can continue your talk. Atindra, are you able to hear me? Connectivity issue. Atindra, are you able to hear me? Atindra, you can rejoin. The audio is not good. Atindra, are you hearing us? Yes, audio issues. So, yes, Dhaval.
Yes,
So,
sir.
did you do any kind of marketing, or how did you start your practice, and how was the marketing and branding? You did some active efforts in that?
Yes, sir. So essentially, our marketing was only word of mouth, and this
Okay.
is the absolute bare truth when it came to our practice. And I always believed in that.
Yes, you carry on.
Yeah. So our complete base of our marketing was word of mouth. Uh, Having said that, uh, since we were into specialty practice, uh, we started getting a lot of second opinions and third opinions, especially repair and redo
Rejoin,
cases.
rejoin. Yeah. Yes.
Especially a lot of redo and repair cases. And that is where we started seeing a significant jump in our referrals of patients. And obviously, our challenges were also increasing in the second year of our practice setup. So we started upgrading ourselves in terms of our competence, our training, and we started having a more academic bent of mind. So we started also publishing a lot of our cases. So that's where we got a lot of reach in the first 2 years or so when we started our practice. And then, of course, when I joined the Dentopreneur Academy, we were really coaxed into the digital marketing concept, which I was not really aware of. And I think that's when we first started with a simple thing like putting it up, our digital marketing strategies came into picture. Simple strategy like putting it up, putting our practice on Google Business, my page, and then, of course, on the other digital avenues like YouTube, etc.
Great. So, where did the first few patients come from? First few means actually first few.
So, sir, this is very, very interesting. I still remember the first 5 patients on the when we had just finished the puja of our practice, and all the 5 patients were out of job in the pandemic, and they walked in with acute pain and without any appointments. And of course, that time we also didn't have any appointment system very strictly. But fortunately, we catered to them. And out of that, about 2 patients who were actually working as general managers at a leading bank, they were so much in pain. And since the pandemic had just hit them, they were very scared to commute. And they for about a month or so, they had not received their paychecks or something. So what had happened was the first 2 patients had actually told us that, we want to come into your practice, but we don't know whether we'll be able to afford a dental checkup or a treatment. So we told them that we are going to treat you, and we'll blindly trust you, for whatever during the pandemic your financial credentials are at the current pace. And sir, you will not believe it that we treated them, and for about 3 or 4 months we had not really followed up on their billings. And I think after about 6 months or so, both the patients, they just walked into our practice, giving us our treatment bills. And now, after so many years, those patients are the most loyal patients in terms of our referrals. I think we've got close to more than 175 patients, families referred by them.
Yes, exactly. So this was also my experience when I was in UN Mehta Hospital as administrator. We were treating the cardiac patients for free in the first hour. And we didn't first charge the money, we did the treatment first. And so many people who are really poor, and at that time all these schemes were not there. So they used to come and give the installments. Sir, installment में ले लीजिए, नहीं तो मैं हमारे husband को फिर से हो जाएगा.
हाँ जी sir.
That is the good thing I see.
So in fact, a lot of colleagues of mine, when they ask me and our office team that aren't you strict about the billings, etc. So we do have a system in place, but now after 3 years of our own practice, the trust factors are so high with the patients, and people who are already referred to us know our background. So this has made tremendous difference.
Right. He's struggling with his. Atindra, are you able to hear us? Atindra, are you able to hear me?
Yes, sir.
Yeah. Okay. So your take on any marketing you did?
Sir, pardon, sir?
Start the video. Yes, better. अभी अच्छे लग रहे हो. Are you able to hear us?
Yes, sir. I can hear you.
So did you do any kind of marketing? Any kind of marketing initially in your practice? And where
marketing, what is a mouth to mouth was there initially, right? Because when I started my practice, and as it is a rural area, so mouth to mouth was going, arranging camps, and that's all. But recently I have gone for the latest update. I have enrolled in Google My Business also.
Okay.
And I'm starting other in WhatsApp also. I used to play ad.
So you are now techno savvy ho gaya.
Yes, sir. By slowly I'm getting updated.
You got your website also, right? Made.
Yes, sir. Website also.
He's going to have an app also very soon.
Yes, sir. App will be coming very soon.
Yeah. So where did you get your first few patients from? पहला दूसरा तीसरा पेशेंट कहाँ से आया था जो आपने शुरू किया?
Sir, using the app, sir.
नहीं आपके एक्सपीरियंस में जब आपने प्रैक्टिस शुरू किया था, when did you get the first patient from? On first day you opened, you got a patient?
First day, sir, one patient, sir.
One patient.
One patient. That was a referred, and that was a case of post-extraction bleeding by some other dentist.
Okay.
That is a memorable, sir.
So what did you do there?
Sir, I took the history properly. I put the local anesthesia and I sutured, and it was all right, sir.
Fine. Difficult ball for a first timer, na?
Yes, sir. I remember, sir. It was...
So what were the initial challenges in your setup and how did you overcome that?
Sir, initially, sir, as it was a new clinic and I was also new, what I feel that the patient were not confident that is this clinic will be my right clinic. So there are some competitions were there. That they used to suspect that whether I will go to him or I will go to Guwahati, which is 15 kilometers away from here. So to get the confidence and the communication skill was one of the important things, that whether I'll be able to manage the patient. So whether what I say, patient will understand me or not. If I try my best also, if the patient will be convinced or not, that was one of the factor.
Right.
But gradually with time, patient also understood that yes, they will get better treatment, and they started trusting me, and it is continuing, sir.
Dhaval, you're take on this.
So, sir, I would like to put it at multiple layers. When I analyzed the situation before we started I was already into consulting practice, so I had a fair enough idea on what the challenges would be. But when we bought a practice, when we started our own practice, the challenges were at multiple levels. Level 1 was that in a radius of about 1 kilometer in a metro like Mumbai, we have about more than 10 to 12 clinics, at least in my area where we practice, we have multiple clinics. So the challenge as a dental professional for a practice was that how do we pitch in terms of patient care? What is it that we want to do in terms of quality patient care? That was challenge number 1. Second level of challenge was from patients who were coming to our practice. They either were treated already or not well informed about the multiple treatment options. So for patient during consultations, we even now we have a very open policy in giving patients all the options. And one of the most important options is you also don't need a treatment. So patients accepting that level of multiple options, for us, it was challenging. Eventually, I think as weeks passed by, we were trying to sort of gather into it like a ball, and the treatment acceptances were better from the patients.
Great. This aspect of not telling them not to do anything sometimes works in a very, very good manner, because if you're a surgeon or a procedure doing, and you tell that, okay, this surgery is not required, or maybe this surgery is not required, they'll build up the trust like anything. This surgeon is not after money.
Absolutely, sir. Absolutely. So we do a clinical audit, and I highly recommend this to a lot of dentists and dental surgeons. Be in the habit of doing an annual clinical audit. What is a clinical audit? We all do financial audits, but a clinical audit is something which we need to do every year. At our office, the clinical audit is from September to September every year, and we have each entry of the patient work which is done, and including the treatments done, diagnosis and x-rays, etc. And then we file it up and we see that what has been done over a period of 1 year. Out of these, we segregate that into first-time patients, redo or repair work, and opinion given on no treatments required. Now, when we started doing this, it was a Pandora's box which opened up. So our quality control became very, very straightforward. We knew exactly what we have to do in the next 2 years. And the other thing which is most important, and I'm sure a lot of general dentists will relate to this, is we know exactly where we need to invest in terms of dental materials. Because, sir, in my experience, good dentistry requires good dental materials. And I think to run a successful dental practice, we all need to know and understand that what is our cost in terms of the dental materials. That's how we will try and make a framework of our treatment charges.
Right. Very well spoken. Second, next point is like, as far as the skill is concerned, all of you are good. But then there are something others which are need to be understood or managed. So how do you manage your finances?
So is this for me?
Yeah.
Okay. So I am actually fortunate that my younger brother is a lawyer and he's an avid investor. So for me, right from my 10th standard days, when he's 4 years younger to me, he was always a very avid finance savvy person. So even though he's younger, but I have always taken his views on that, and that has always worked for me. So he's always there to sort of help us in terms of our finances, especially on financial audit controls on dental practice. Because what also happens is that, for example, how do we know that we have to charge X rupees to take an X-ray? Or how do we know that we have to charge X plus Y for a dental tooth extraction? So there has to be some method on that, which is also called as return on investment. So I think successful practices work on that, and we have been following that models.
Atindra, how do you manage your
So as far finances is concerned, so what I do, I make a tally of documents of all the revenue per day, and at the end of the month I calculate, and out of that what came and what expenses I calculate, and actually I plan for the coming 6 months. So what are the materials needed required per month, consumables like starting from gloves, syringes, local anesthesias and all. So the clinic management is planned in such a way that revenue and expenses, and I calculate accordingly. And what about the treatment cost also, as it will depend on the what quality of material I am using. So on that we'll calculate, and accordingly we'll sort out. If you want to procure some new equipment also, so we'll see the demand and supply. If you want to upgrade and if the revenue is coming, we'll calculate on that and we'll purchase a new equipment, and upgradation will be done in that.
Great. That is an easy approach, but a good one. Quarterly survey or 6 monthly survey. So Dhaval, next question I wanted to ask is, what is the importance of training you and retraining yourself? I mean, what you have undergone many fellowships. How has all those helped you? And do you recommend that they should be done for all other junior dentists also? They should go for, should they go for fellowship and training? How important is it?
So, sir, this question is very dear to me, because when I was doing my undergraduation, I think during the final year, BDS, I was quite lost in terms of what do I have to do later on. So one day I went to my oral surgery head of department and I asked her that, ma'am, I'm quite lost in terms of what do I do next, and what do I do? I mean, I don't have focus. So she only told me one thing, that always remember that even after you pass out your graduation, invest in yourself, in re-educating yourself, not only in terms of newer technologies, but also go back to your contemporary undergraduate textbooks. And that is how you're going to see the growth in your professional life. And so that has been the best advice ever. And I remember this reiterated by the Dentopreneur Academy when the first day of my, when I joined the academy online. And I think Dr. Amit sir had mentioned the same sentence. In fact, I've written it down in the drawer of my practice. So I cannot overemphasize on this. So I think it gives great, it reaps great benefits for one to undergo continuous training, because I think that's the way your outcome is dependent on in healthcare.
Yes, Atindra, what is your take?
Sir, I believe in the concept of being a lifelong learner. So being a BDS also, as I practice in a setup in Jagi Road. So, and there are different specialists of dentistry. So I trained myself in implantology also, dental implantology. So I practice dental implants also. And I got some training in aesthetic dentistry also. So I practice there. So being a BDS, it is not the end. There is no limitation. So if you want to upgrade your practice, we need to get trained in different specialties, attend conference and workshops. So what we learn and what new things we can learn, we can get that training, upgrade ourselves, and give best treatment to our patients. So I fully support that. Training should be done. Upgradation and updation is a must.
Next question is, Dhaval, how much staff do you require actually? And how do you, keep their mood upbeat and keep them motivated? And how important it is?
So this for practice management is a very good question, and I think one needs to focus on this. Now, I would like to break this question into how large is your practice. If it is a one operatory practice, a typical staff distribution, and I would call it the staff mapping, would be that you need that dental practice with one operatory would need one front office staff to handle the entire front office, and one dental assistant, and whatever the staff of the doctors are. But these two are mandatory. As we scale up the dental practice, your front office and your assistant staff will keep on increasing and decreasing depending on what kind of procedures. And is the dental practice performing a 4-handed dentistry? 4-handed dentistry means that one operatory, if you are performing any procedure in the mouth, we have 4 hands working on that patient. So depending on the scale of the practice, minimum amount with one operatory would be one front office and one dental assistant. And as we scale up to 2 operatories, 3 operatories, 4 operatories, we can use that method and appoint our staff accordingly, sir. But I have always believed that this should be the norm, because it makes the working environment very comfortable to the in the dental office, as well as for patients who get confidence that it's not just one person who's handling everything.
And do you get trained staff, or you have to train them?
So, sir, this is, I'm sure everybody would agree in this on this forum. India, we do not have trained staff unless you are getting a trained staff from already dental offices. If the staff has already working.
From one to other.
Correct. Other than that, we do not have the wherewithal for a trained staff. So the only way to cultivate an environment, we have done it at our dental practice, and I'm sure a lot of other dentists are also doing it, is make efforts towards training the dental staff in not only the technical aspects of assisting, but also soft skills, which I feel for having a successful practice is very important, sir.
Very good. Atindra, what do you think?
So initially, when I started my practice, there was only one attendant beside my chair. So he used to sterilize the things, autoclaving, cleaning, and everything. So gradually, when my practice grew, for the front desk, there are 2 people, and inside helping me, there are more 2 peoples they are not actually skilled initially, but it is very difficult, as sir said, in a country like India, and also especially in a remote area. So we have to train them, the clinical side, how they will attend, and to train them which extraction forceps, which is for upper, lower, and which is the filling material, which is how much water they have to put for autoclaving, and everything, which instrument is sterilized in what way. And also sir?
खुद ही सिखाना पड़ता है सब कुछ.
हाँ सर, खुद ही सिखाना पड़ता है सब कुछ. Even sir, वो patient आता है, patient के साथ कैसे बात करेगा, how they will talk. I used to tell them that patient has not come here for something else. Patient has come in pain, so you should be soft enough. At least we should try to minimize the pain, not to maximize the pain. If we cannot minimize also, if it is remains same, then also they will be satisfied that something is not aggravated. But if it comes and some harsh voice coming from their conversation, then that will definitely decrease the pain threshold and there will be more pain. So I always tell them that don't do that. They come in pain, treat as if that they are patients, they are not our murgas. So if you, if you think that as a family members, and in fact, what I believe that to be ethical, I try that, can I use this treatment or can I use this material for this patient? And will this medicine be perfect for my family members? If my conscience said yes, then only I go for the treatment, so that no over treatment or unethical practice is warranted from my side.
I can understand, because from my personal experience, a dental chair is a difficult place to be. I have very, very scary childhood memories of being with the dentist, because I was very fond of sweets and used to do brushing only once. दो दांतों में तो there was root canal treatment. So next question is, how have you taken, I mean, has the patient feedback impacted your practice? Do you remember any patient feedback which was very crucial in turning your practice? Dhaval?
So patient feedbacks, definitely yes. So how we do at our practice, sir, is we have internal and external. These are two modalities of patient feedbacks, what we like to take. What is internal and what is external? Internal means that internal in office. So we encourage our patients who come to our office to openly give us feedbacks right from our appointment timing, appointment scheduling, if there has been any issue, delay in any dental work, if they have felt that the practice has been unhygienic at any areas where they feel, if they have felt that at some point on the telephonic conversations, if the staff or any of the doctors have been rude to them. So this is what we call as internal feedbacks. External feedbacks means that we encourage our patients to give us feedback in terms of their treatment plans. For example, some of the patients, most of our practice, at least our practice, we do a lot of second opinion and third opinions. So repair work is something what we do. So when patient has already come to us, they have already been treated for something, and then we are retreating them. So if we have done it, and our first modality would be non-surgical, for example, we would encourage the patient to give us feedback in terms of long-term follow-ups. We have their follow-ups for 2 years, 5 years, etc. And then we ask them to give us feedback in terms of what was their experience, in terms of the earlier treatments and the treatments which have been done at our office, along with their X-rays and photographs, documentation which is done. So this is what they like to do, and some of them they ask us if they can put the feedbacks on, as Atindra mentioned, on Google My Business page, etc. But other than that, both these feedbacks work wonderfully well for word of mouth practice patients, sir.
Some questions have started pouring in. Yes, I request all of you to please write questions in the chat box so that you can take it in the end. We'll answer all the questions. Don't worry about that. Only thing is that you have to sit to the last question. Yeah. Atindra, what is your take on feedback from the patient?
So feedback is very important. So it is very difficult that I will be able to satisfy 100% of my patients. So definitely positive feedbacks are always welcome, but sometimes negative feedback also may be there. We can expect, and from that negative aspect, we should try to do some research. Then what are the pain points there? The patient have given a negative feedback. That negative feedback will help us in providing better service in the future. That positive feedback is impacted once I mentioned a case of avulsion, that a student of class 10, while playing kabaddi, his one central incisor came out. So what I did, I replanted the tooth. And that case, the patient, actually we should go for a follow-up after every 6 months, doing the IOP X-ray about the any development of pathology. But the patient, as there was no complaint, didn't turn back physically, but I used to ask their parents and relatives that what he's doing. So that patient, he passed his matriculation examination, ACS, science, and also he studied engineering. He completed and doing job now. And till date, that tooth is fine. But that impacted so much in the society that I can, if a tooth comes out, then I can replant. In my society, in my locality, there is a thing that no problem. If there is, the tooth is coming out. Recently, I've done several cases of replantation also. So everything, all cases of replantation are nice, and they are spreading some good news about my treatment in the locality.
वो जैसे आजकल ऐड आती है ना कि दाग अच्छे हैं, ऐसे लोग बोले दांत टूटना अच्छा है, चलेगा हमारा डॉक्टर लगा
Yes,
देगा
sir.
वहाँ पे.
लगा देगा.
Good. So that is good. Next question is what is the importance of upgrading the instrumentation or the equipments in your clinic? How often you should do it, or what is the way you follow? Dhaval.
Okay, sir. So, sir, basically what we do at our practice is we make a list of the very basic essential instruments which are needed to run a dental practice. And when we make this list, every 2 years, we like to upgrade this list to whatever newer design instruments have come in. So, for example, any surgical instruments, very basic surgical instruments like forceps, etc., which have come in, periotomes, luxators, which enhances our minimally traumatic extractions. We'd like to upgrade it as and when we also have the budget allocated for those. Apart from this, we look at the other set of instruments, or for example, I'm sure everybody would agree that in the last 5 years or so, dentistry is heading heavily into digital dentistry era. Now, here is the catch. If we are, lot of dental practices are investing into newer gadgets, for example, the intraoral scanners or 3D printers. I have always believed that we need to have, and that is, here is where our internal audit, which we do, will really make things very visible. That is our practice equipped financially to have that kind of investment, or there is an option to also rent out certain of these high gadget inventories. This is what we do. And if we feel that our practice is not really equipped financially, we don't like to just go ahead with any large financial investments until it really makes sense.
Don't buy for the sake of buying it.
This is what we are. Yeah, that is what I and my entire team, we believe in, sir.
Great. Atindra, you have a journey from the second-hand one table to now new many tables. So what is your take on that?
Exactly. There is no specific date that for 6 months, 1 year, 2 years will switch off. But of course, I attend conferences and lectures of best speakers. So in that, if they give any indications that this is better for the patients, then I switch to that particular instrument within the budget. For example, that local anesthesia, what we use, that is the normal disposable syringe also we can use. But recently, I have upgraded to the molecular also chain. Instead of lignocaine, I started using articaine, and also that is a non-contaminated, painless form of anesthesia. So in such a way, even for RCT also, initially I used to do that hand instrument. So day by day, when the demand and the expertise and the time consuming the hand instrument, so I switched to the rotary instrument. So in this way, the X-ray machine, which conventionally I used, now using the RVG, where no dark room is required, less time is required, sophisticated, in one click, it is done. So within the cost and as per the upgradation, the latest demand.
Great. So very good questions answered. I mean, I really praise both of you that your real depth in the practice and experience you have shared. Lastly, I want to ask you that what is the advice to the new dental surgeons who are coming in the practice from you? Then we'll take the questions and then we'll open the discussion for the house. Dhaval,
So sorry, I didn't get your question.
what is the advice to new dental surgeons who are coming in practice?
Okay. So one of my biggest take on this to a lot of young Turks is that there is huge scope for very good dentistry, and it's just that you need to be very positive and you need to be having the right mentors and right seniors to guide you. I still ask and seek a lot of advice from seniors. I don't have two qualms about it, but I think that is a way to go about it, and not just blindly go with competition, etc. Everyone, there is scope for everybody to have patience and to do good work.
Great. Atindra.
What I would like to advise is that the focus on the goal, they should have a definite goal and they should make a system. Under this system, the all should work, and a patience, you'll not be able to upgrade in one day, but you should keep patience. Slowly, there will be upgradation. You should do ethical practice, good quality practice, and keep on adding values to your patients. Then money will definitely come as byproduct.
Great. That is a great discussion we had today. Once again, I'll say thank you and have a nice day. Have a nice week ahead.
Thank you, sir. Thank you so much.